Level up your care navigation with Engage. Step 1. Review your groups or team inboxes. Engage Consult gives you the power to configure your care navigation in the way that works for you and your team specifically. You might have already been using Engage in a particular way, but if you're rethinking your care navigation at the moment, it'd be a good idea to review how it's currently set up. So from the request view, you would go onto the profile button and you would go across to groups. Groups are another word for team inboxes. So here you'd be able to see all of the team inboxes that are set up in your Engage. And this means that multiple users of Engage can cover a team inbox. So if I was a doctor, I might come in and think, yeah, I'm okay with these ones. Cancer care doctors, don't think I need to cover all incoming requests. So I'll untap that and then save. And then when I go across to the request view, it shows me all of the team inboxes that I'm covering. It pulls them all into one here. And of course, I can dip into the others if I want to. But in order to change this, you would head over to the management console. To recap, review your groups by selecting the profile icon and the Groups tab to see your current group setup. And think about how you'd like to manage your requests going forward and if you need to make any changes. Step 2. Changing your groups or team inbox setup. From the management console, I would go to the advanced section, and here you can see the option to select groups, and you can now add any team inboxes or groups that you want. You can remove them, so if you feel like your groups are a little bit too cluttered and you want to simplify the way you're doing things, you will be able to do that here by deleting groups, editing the name of groups, or adding a new one by clicking add group here. And you can give it a name and you can share it with other organisations as well that you might be collaborating with. To recap, go to the management console and then the advanced section on the left at the bottom. Then select groups to add, change or remove groups if required. Step 3. Set up your care navigation rules and reduce the time it takes to assign patient requests to the correct person or team. You're able to level up your care navigation with Engage from the management console by going to care navigation here. We've completely refreshed this and it allows you to add certain rules for request types, medical problems, admin queries, and certain health data submissions. And you're able to direct them to the right place at the right time without anyone even touching that request. So it should save you time. You'll be spending less time filtering requests and sending them to the right place because Engage can take care of the simple ones for you. So let's go to the miscellaneous section. Here you can see that I've added a rule that asthma related requests will go straight to my asthma clinic team inbox or group. And we have blood pressure that's going straight to Claire Flynn, the AMP. But if I wanted to edit this, I could actually edit and add a priority. So I'm going to make this urgent priority so we can get that blood pressure looked at. You can also add rules for individual patients or for certain groups of patients. And here you can see that I've already added one for Jenny Johnson because she has a particular need. Maybe she is a cancer patient or she's at the end of her life. We can see that we've added a rule for Jenny Johnson to be treated as urgent and to be routed directly to Dr. Knight's inbox if she was to submit a request. And also we have other options. You can add a rule based on all of these things. You can even do that for a group of patients by uploading a CSV file. So if there's a particular group of patients that need to be routed to a particular place, you can do that from here. To recap, go to the Management Console and select Care Navigation. Easily route certain requests to the correct person, team or organisation within your network as they come in. And set up care navigation rules for specific patients with a particular need. And reduce the time it takes to get patients the support they're looking for. Thank you. If you need a little extra help from the Engage team, feel free to email training@engagehealth.uk.